Well, welcome back to another episode of The Compass. I'm here live with Dr. Brad Robison and one of his colleagues, Cynthia Cox, nurse practitioner. It is amazing to have both of you.
Thank you for having me.
Yeah, it's great to be here again with you, man.
Now,
Catching up.
Cynthia, I've heard that you spent, I guess, 15 years in more of a bedside traditional nursing situation. You're making a move into mental health care. Walk me through your journey.
Yeah, I think in the acute care setting, every mental health touches every patient on some level or not another. Then when you have in your own personal life a grief journey, family members that have dealt with different mental health issues, you see the gap, or I saw the gap in what was needed and what was here locally. I asked one of my friends who's a therapist. I said, I think I want to go back to school and be a therapist. And she said, have you ever heard of a mental health nurse practitioner? And I'd never even heard of this role. And once I looked into it, I was like, oh yeah, that's what can help fill the gap between what we have now with primary care and what's needed.
And Dr. Brad, a lot of times you actually call yourself a primary care mental health professional, right? It's like
Yeah.
primary care for the mental health department.
Yes, absolutely. Yeah, I mean, I set this whole practice up with that concept in mind. I mean, I did a fair amount of pediatric training, a little more than most psychiatrists do because I was originally in the triple board program. I did transition uh, during my training away from that specific program, but because of that, I actually through medical school and through the first 2 years of my internship residency, I did a lot of pediatric primary care. I worked with some just fantastic pediatricians and behavioral pediatricians in primary care settings in Utah, where I did my training at, and at the University of Missouri Columbia, where I went to medical school. And so I guess I've just always had that primary care model in mind of establishing long-term relationships and not not the old school psychoanalyst long-term relationship, but a primary care long-term relationship where people see what we do as their place for mental health care when they're at different stages of development of their family. A lot of times it's the moms that are making the decisions and making the calls, to get this set up. And we want to really be a resource for when, Johnny's having trouble transitioning into first grade or something. And we may do a piece of work and then we may back off and we may not do another piece of work until Johnny is having trouble in junior high, or Johnny's younger sister's having trouble in fourth grade or something like that. And so we want to really be there in that way. And that's a lot of, Cindy has an interest and a passion for that as well, and with background in nursing.
Yeah, I think that that's a really important place for service to families and is definitely needed. Cynthia, you made it sound like there are certain stories and things that you were coming across that actually propelled you to this place.
Oh, absolutely. I think my mom, for example, is kind of one of the big gap that I saw. She has struggled with depression for years, and she was seeing her primary care physician, and she started counseling based on my recommendation. And her primary care doctor that didn't feel comfortable changing or raising dosages on antidepressant medications, and also made the comment that if she was still needing counseling, that it probably wasn't working. Mm-hmm. And that's just a drop in the bucket of that instant fix. If it's not working, try something different. And that's not really true for mental health and what those long-term relationships can do in that healing journey.
Well, I think that's so important. And, like Dr. Brad said, establishing meaningful therapeutic relationships that exist over the course of 20 years. And I think, Dr. Brad, maybe there's some stories that you can share of people who came in for one treatment and were off of it and maybe had to do something else. And over the course of 20 years, you're able to see that big picture of their life.
Oh, absolutely. I mean, I feel like that's a lot of what we can offer. Had a great call yesterday, I think it was yesterday, day before yesterday, with a young man who I have seen off and on since he was probably a kindergartner or first grader, and just a bunch of different things. I could tell a long story. Maybe some point we might have him on. He actually would be an interesting person and I think he would be totally comfortable with that at this point. But he's in his mid to late 20s now. I haven't seen him for a few years, and he's got a story, right? He's been through some things, and he's created some of his own drama a bit. I think he would be the first to admit that, but he's doing much, much better. And I hadn't seen him since 2018, and he reached out to me just because he wanted to update me on how he was doing, because he recognized that he had really made some big changes and some big strides, and that he and I had been together through, some of those primary care, mental health care things through different stages of his life. In elementary school, we walked the journey together through his dad's unexpected death when he was, pretty young still. We went through some of his struggles as an adolescent and substance abuse, I just love it, and I could talk a lot about him, but it's to the point of this conversation. I just thought it was so cool that now, I hadn't seen him since 2018, but he felt that it was important enough that he reached out to me to share another life milestone with me. And I just thought, he's not in the area anymore. But it was just, I thought that was really cool.
Yeah. And it's stories like that help people, I think, understand the difference in the way that the practice is ran compared to other places. Because Cynthia, when you're talking about some of the gaps that exist, one thing that I noticed that feels really different about Dr. Brad's practice is that people actually come in and have conversations and talk about what's going on in their life, as opposed to just coming in and getting a prescription and leaving.
Yes, it's a genuine relationship. And when I first met Dr. Brad, he told me that. He said, it's a genuine relationship. We do 30-minute med checks. We aren't clocking how many people we can get in and out of the door. And you build those relationships through those checks. And it's completely different than what I've been a part of before.
Yeah. What has really surprised you about going into a deep dive in mental health care? Like, what are some things that you maybe thought, hey, this is actually a really positive thing I didn't realize. Here's some improvement for the whole industry.
Wow.
Yeah.
Yeah. I think Cape Girardeau has more resources than I thought they did. They definitely have more resources than they had in the last 10 years for various aspects of mental health. And I think that's something to be proud of. I think there's still room to grow. But I think that this area it's trying to recognize that the gaps and fill the gaps and not leave these folks underserved as they have been for years.
Yeah. And I think one of the things that, Cindy and I talked about and her own experience that she was just sharing, family experiences, that, we've got a lot of great primary care providers in the area, and they're just, they're trying and they're doing, I think, the best they can. And they overall do a really good job. The struggle for them a lot of times is in that gap between them knowing. They know most of the time, they know when they really need more support for a patient, but the access to that support is the problem, we've chose here to try to bridge that gap in a way that's it runs counter to the culture over the last several years, from the standpoint that we have tried to bridge that gap by building those meaningful relationships and providing that longer term primary care. Now that means that we intentionally haven't set this practice up as a crisis oriented practice.
Yeah.
Which almost sounds counterintuitive. It's like I'm recognizing on the one hand the big need in the area, but I'm not setting up a quick, okay, where the primary care docs can refer a patient to us and we'll get them in for a few visits or whatever. I mean, it's why we have grown. It's why we have 4 nurse practitioners now and all of that, because we can get people in relatively quickly. But to me, what the area needs, well, let me say it this way, what the area needs and what the area doesn't need. What the area needs is more mental health practitioners that have the freedom and the ability to establish truly long-term therapeutic relationships, which then reduces the crisis issues so that we're not clogging the primary care doctor's offices and we're not clogging the ERs with crisis-oriented stuff. We don't need, if it's the old medicine 2.0 model that we're trying as a whole field, we're trying to move past. We're not trying to build more emergency rooms at the bottom of the cliff.
Yeah.
That doesn't really help. We've got to be up at the top of the cliff, meeting people and guiding them and supporting them and helping them and keeping them from falling off the cliff.
Yeah.
And that's what we're trying to do here, Yeah.
Is some of the issue why it hasn't existed due to just the financial operations and the realistic nature of the sheer volume of patients that have to pass through in order to make a successful practice? Like, that's the tension point, right?
Yes. That's the practical tension point. It really is. I mean, from a very practical standpoint, I saw the reality of that and the strain of that early on. I mean, we probably talked about it on some of these things, but I had the privilege of training with some really good people that were business leaders. Dr. Baxter Bob Baxter was the CEO of Bingham Child Guidance Center. He wasn't, the medical director, and then somebody else actually ran the business side. He was the CEO. He ran the business and the clinical stuff. And we talked a lot about these things, and the pay structures have been such over the last couple, 2 or 3 decades that the pay structures reward volume, over time, volume of a procedure code. You have a procedure code, and you just keep building that procedure code over and over again to build up the revenue stream to cover the cost of the business. That does play a big part in it. Has for years.
And that's a sad side effect of our culture. And when you hear some conversation about public policy around healthcare, I think this is part of that conversation that
Sure.
we try to bring up. And obviously, no one's been able to find the right solution systematically yet. So we'll keep praying that.
And we talked just the other day, and it's, you can start with good intention and fall very quickly into that cycle of more patients, more revenue, seeing as many people as possible, and then you lose what thankfully you haven't lost here, which is that time spent.
You have to be willing to fight for that primary care relationship model. And one thing that I want to, it's maybe a little bit of a shift, but I want to go back to Cindy on is just like, just explain a little bit to people about nursing and mental health nursing and training, and a little more about just what that's all about, and those sort of things.
Yeah. As I said, mental health is bedside mental health nursing and being a provider are different things. I think that therapeutic relationship is important at all levels of nursing. I think we, focus on the medications and the physiologic processes and everything, but it all comes down to that personal relationship for me anyway with the patients. I always tell folks that if you can't be a little silly, then and give them a little bit of yourself, then I think you've missed. So I think that's pretty cool to get to do in this site as well. Having that genuine relationship, but the learning process has been different than I thought it was going to be going in. And I think my learning experience has been incredible with the range of patients that Dr. Robison sees and his other nurse practitioners throughout. I was scared of the children like that, because I'm an adult. I take care of adults in the hospital, and the children kind of scared me. And there was a quote that said, these kids don't need to be impressed by you. They just need to be seen by you. And I was like, okay, good. I don't know how to do the other one.
Pressure's off.
Right,
Yes,
right. I was
yeah.
like, they are not going to be impressed with me. And I think that's what Dr. Brad models very well, is just being genuine with these patients. And that's half the battle.
Yeah.
Is there's medications are, I'm going to start quoting him, are just a tool in the toolbox for practitioners, for clinicians. But there's so much more to learn that I don't think you ever really get to the end of the list of things to learn.
Yeah, absolutely.
One thing that's unique about Dr. Brad's practice, and I know when he brings in nurse practitioners, this is part of the journey, is creating that sacred space, a place that he describes to explore and experience the reality of God and become all we were created to be. And some of that you're talking about is in essence that moment, isn't it? Where you're like, I don't have to impress them, but they need to be seen and known and heard.
Yeah. And he says, leave space for the Holy Spirit to be in the conversation and be part of that healing journey. And honestly, that I was like, oh, I can do that for a job. Like, sign me up. Because that sounds incredible. And your ego is not part of it. It's the healing journey isn't something that we orchestrate. We just navigate with the patients.
When you have one of those moments, like, where that breakthrough happened, that the patient walked out and they're different than when they came in, is that like for you adrenaline when you go home? You're like, this was so fun today.
Yes, I've had a couple. And I'm like, that was incredible. Like, sign me up. If you get one, I think I said, if you get one of those a month, I think it would keep you fueled for more, because you just feel lucky to be there during it. Like I'm just shocked. Like, you do, it is an adrenaline rush and it is an incredible moment. And I'm like, I'm so glad I was a part of that. Go.
It is cool. It's really cool. Just like the call I got yesterday. It's just, just a connection point with another human being on the journey. And it's just so profound. And there was a lot of, my mentor used to always say that, we're, something to the effect of we're getting through the mundane, waiting for the sacred to happen, and there is, with that kiddo, he's a young man now, but oh my goodness, he was the biggest, knothead for a lot of the time we worked together. And I say that genuinely and lovingly. I loved working with him. I loved working with those kiddos, but he was a mess. And there was a lot of days that he and his parents and I were just pulling our hair out thinking, oh my gosh, but we got through it, and we're seeing, the other side of that, which is totally awesome. And I think that's cool. That's another thing too, like having Cindy here, and I've been saying a lot the last couple of years, or 2 or 3 years or more, around here. Paul and I didn't set out to build a big business, and still don't intend to build a big business, but it's just over the last 10 years, especially, it just seems like the right people have come along, the right people that have, a mindset of what we've been talking about today. And if I can, in some small way, provide a place or help provide a place for those people to practice and build those relationships, that's absolutely what we want to be doing. So, yeah.
It's very unique and important. Cynthia, what were you going to say?
I was going to say, I joke that I stumbled into this learning experience and don't ever want to leave. And it was totally led by the Holy Spirit how I got here. And so to hear you say that, because it wasn't my original intention. But then once you see this practice, you're like, I can't do anything else.
Yeah. It's kind of cool how God does that sometimes, like wires up circumstances, situations, and you're like, oh, this is the fulfillment of these things I had inside of me that I didn't know. I wanted to go back a little bit to the story we were talking about, just feeling excited about having a breakthrough. Do you think if other patients saw the breakthrough that someone else had, that they'd be more vulnerable, or is it not indicative?
Yeah, I don't know if it's indicative. I think it depends on the patient. I think if you show somebody that, yes, there's hope on the other side, there is light at the end of the tunnel, all those, things, the platitudes that they hear, but then if they see it, some people, I think that would motivate them more. I've had a couple experiences with that, just in general public, outside relationships, where they're like, oh, well, it's possible. If I put the work in, I can heal. And so I think it is potentially would be eye-opening for some.
Yeah, I think there's power in a story.
Yeah.
That's an interesting question in some ways, Tyler. That's, there's we've grappled with that here for a long time, because groups, we have tried to develop some therapy groups, and Gloria has had some success with it. One of our therapists here has had some success with it, but I don't know if it's the area, if it's just us. It seems to be the area, because I know a lot of other mental health providers in the area have also tried and haven't had much success with groups in this area. So I think there's something about that. But we've had tremendous success through Sacred Space Ministries and other, a nonprofit that Paul and I are involved in with groups. And I think, we've been doing that for 12, 13 years now. Joe and Jeremy Pincosi run that, but we still participated in some things. And the last small group that Joe and I did, the people that were participating in it, their description, because at first they're like, well, they were like on board with doing it, but they were like kind of a little unsure, well, what this is. And we, of course, were trying to explain to them what this is. But they, a couple of them both said, I don't know, 2 or 3 of our group times together into it, they're like, oh, we get it now. It's like somewhere between a therapy group and a Bible study. And I'm like, well, yeah, I guess in a sense, yeah, that is sort of what it is. It's not, we're just trying to create space and have deep existential conversations. It's not like we're doing a Bible study, like, oh, come and we're going to teach you the Bible in this or that way. We're just creating space for people to explore deep questions.
Yeah.
Just facilitating, letting them share whatever their perspective on those deep questions are. But in that kind of a setting, the group experience has been, I think, very transformative, because people start to, they create safety for one another. We've had trouble, like I said, creating the same kind of experience actually in this setting for some reason, but.
Yeah, and I could see that. There's obviously cultural, sounds like, implications or reasons why that could be, but who knows what else. I think, the general thought is like, hey, stories are helpful, and hearing these stories are encouraging to me, and
yes,
sometimes people need those, as you mentioned, Cynthia, is just a little piece of fuel in their journey. Yeah. Well, this is fantastic. Is there anything else that you guys wanted to add to our conversation today? Or you feel good? Feeling good?
Yeah. I think we're covering it. I just appreciate Cindy being here and sitting in and coming along the journey with us here. And again, we're just want to try to provide opportunities for patients and families to have somebody that can walk the journey with them.
Absolutely. Well, thank you everyone for tuning in. Thank you, Cynthia, for joining us. As always, you can learn more about us on our website, bradrobisonmd.com, and we'll be back again for another episode of The Compass very soon.